In August, Nigeria began a second phase of nationwide coronavirus vaccinations in a bid to contain upsurge in cases of the Delta variant. The country has acquired millions of vaccines and it is targeting to vaccinate 40% of its population. That is about 80 million people by the end of this year and another 30% by the end of 2022. Inasmuch as the country is vehemently campaigning against this deadly disease with sensitization and vaccination, the virus has continued to fight back with its variants as day in, day out, new infections are reported across the country. Today, the number of COVID-19 cases in Nigeria as released by the Nigeria Center for Disease Control stands at 211,171 confirmed infections, 202,674 treated and discharged, while 2,884 people have lost their lives to COVID-19. With this, can we say the country is doing enough in combating coronavirus and its variants? What is the response of Nigerians so far in this fight, and are the protective measures producing the desired results? Nigeria Today will seek to address these issues as we discuss COVID-19 matters arising. I am Lydia Odije Ochi. Welcome to the program. With me is the technical head, Presidential Steering Committee on COVID-19, Dr. Mukhtar Mohammed. Nice to have you with us.
Good evening. It's a pleasure.
First, give us an insight on the level of infections across the country. Are we seeing a decline or an increase?
Well, first, let me say that the number of cases in the last few weeks generally have shown a declining trend in the country. Although we are seeing some spikes of rises of infection, particularly in FCT, we're also seeing some increased hospitalization in the FCT. But generally across the country, we will say that the number of cases reported now has decreased, particularly Lagos, that used to be the epicenter of the pandemic, has consistently recorded a decreased number of cases over the last 3 to 4 weeks. So generally, we'll say that yes, the reporting has decreased. We have seen less hospitalization. We have seen also less mortality generally in the country. But this does not mean that we should lower our guard or we should stop what we are doing. But rather we have to continue vigilance, we have to continue testing, we have to continue diagnosing, and we have to continue caring for people who are infected.
Okay, now the NCDC has attributed most of the new infections across the country to new variants, like you earlier said. What are the variants presently in Nigeria?
You know, earlier on in the pandemic, we had certain variants in the country, which are mostly the B1531, which was the UK variant, as it was called. But later on, in the last 6 weeks or so, we've seen that dominated by the Delta variant. This is not only in Nigeria, but globally. Over 90% of new cases almost everywhere is now the Delta variant. We are so lucky. In Nigeria, we know that the Delta variant is the most virulent. It is easily transmissible, and there was this great apprehension about, you know, the Delta variant overwhelming the population and getting a lot of people infected. But we have not seen such infections in large scale as to warrant us to become too apprehensive or to have the fear that it is going to override or overwhelm our healthcare system. So far, our hospitals are not saturated. We still have isolation beds that are empty. Even though we have patients that are requiring critical care in a few of the states, we have not even surpassed the level of oxygen requirement in any state in the country. So we'll say that it is a little stabilized. Even the Delta variant is under control. However, this is not an excuse for anyone to lower the guard, for government to lower the restrictions that we have in place, and to continue to urge the population to continue to be vigilant and to remain safe, and most importantly, to take our vaccination, because vaccine is the only sure way of preventing severe infections and also preventing death.
Okay, we're talking about vaccines now. The country had acquired or has acquired vaccines in its quest to curb the disease. Give us an update on the vaccines available.
So a little while ago, we were quite worried because we did not have the number of vaccines that were required, that we needed in the country. We made a forecast of trying to get up to 40 million doses between end of the year, so that we can vaccinate a significant proportion of the population. We were getting the vaccines in trickles. You recall that we had about the 4 million doses of Oxford AstraZeneca. We had another 4 million doses of Moderna. We had a few hundred doses of Johnson & Johnson, and then additional couple of millions of additional Johnson & Johnson vaccines again. Now, the challenge now is actually for people to go out there and take the vaccines. It is not an excuse to say that vaccines are not available. Vaccines have been distributed to every state in the country, and from the reports we are having, no state has even, or is near depleting the quantity of the vaccines that they have. So vaccines are available everywhere, so people should just go out, troop, and take these vaccines. And we have to do it very fast, because it is a race against time. We have to build up our national immunity up to that 60 or 70%. We have to confer population herd immunity, on our people, so that majority of the people can now be vaccinated and will not be prone, to becoming severely ill or to have the risk of dying from COVID-19.
Okay, you are telling us that some states have these vaccines and they still have more than enough. What's causing the hesitancy? What's responsible?
So hesitancy, as you know, is a function of the factors that will make people to take the vaccine, against the factors, that drive the people away from taking the vaccine. So the factors that drive people away from the vaccine, are very obvious. People are listening to other sources. There is a lot of fake news. People are believing in some conspiracy theories. People are still not open to believe that either COVID-19 is true or that there are some other motives, and some is just sheer ignorance. For example, many people do not understand why, after being vaccinated, we still ask people to wear masks or to do social distancing. To them, they will now say, oh, you have been vaccinated and yet you are wearing masks, so it means your vaccine is not effective. Now, that is completely wrong. They need to understand that the vaccine does not prevent you from getting infected. It does not prevent you from infecting other people. However, it prevents you from getting severe disease. That is the most important thing. Even if you get infected, you will not likely be admitted in a hospital. You will not require intensive care unit or oxygen, and you are most likely not going to die from the infection, even if you have it. Compare that to somebody who is not vaccinated. Somebody who is not vaccinated has a 20% chance of getting severely infected and up to 10% chance of even dying from the disease. Now, that is a significant difference, and that is what Nigerians need to understand. Not to say that we have been vaccinated and we are yet wearing masks. And some Nigerians will tell you that they have seen what is happening in other advanced countries, particularly in Europe or in UK. They see that the stadia are full. It's a season for European Champions League, and the stadia are filled to the brim. And they see many people, they are not even wearing their mask. Now, there is a reason for that. In the UK, they have reached a very high level of vaccination. They have vaccinated over 60% of their population. And for anyone who is going to enter that stadium, you must be screened. You must show your evidence that you have been vaccinated, and you must show evidence of COVID test within a particular period of time. So with that, you know, people are protected, they feel safe, and therefore they can ignore the social distancing. Of course, you have to be vaccinated more than 14 days. It is still a risk, but it is, you know, a major risk compared to that risk among unvaccinated people.
Okay, I must ask this question. What is the shelf life of these vaccines? How long can they stay and still be effective?
So this varies. All vaccines have expiry dates, and there are batch numbers. So each batch of the vaccine has a particular expiry date, you know, and of course based on the manufacturers, the shelf life also differs. So the vaccines, as long as you keep them under the standard conditions of the manufacturer, that the manufacturer has provided, they will stay up to the end of that expiry date. Okay. Most of the vaccines we have in the country actually have a little long expiry date. These are not vaccines that are going to expire in days or in 1 month. I think the minimum we have is like 3 months, and we have maximum vaccines that are going to expire even in the next 1 year.
Okay.
So that is not a problem. Our main issue is the storage and handling, which the NPHCD has also made adequate provision in the states to ensure that cold chain are protected for all the vaccines.
Well, it's time to take a short break, but don't go away. We'll be back soon. We have more things to talk about.
This is NTA News 24 broadcasting from Abuja. You can watch us anywhere, anytime on the following platforms. For more information, log on to our website www.nta.ng or join us on our social media handles, Facebook at NTA News 24.
For comments, suggestions and inquiries, send an email to news24@nta.gov.ng or call us on the following numbers.
NTA News 24,
news and more news.
Welcome back. The program is Nigeria Today, and we are discussing matters arising from the COVID-19 pandemic. Still with me is Dr. Mukhtar Mohammed. He is the technical head, Presidential Steering Committee on COVID-19. Now, the Presidential Steering Committee on COVID-19 earlier this month said by December, Nigerians will require to show proof of vaccination before accessing workplace. That's talking about federal workers. Kindly explain to us about this situation and what ignited this decision.
So this is very a sincere policy, and it is done out of compassion for Nigerians. There is no way we will allow Nigerians, you know, to continue to be in this unmitigated, unprotected condition, knowing very well the full benefits of having people vaccinated in the society. And so charity begins at home. Now, the federal government is urging all the federal civil servants to ensure that they get vaccinated before they have access to their offices by December 1st. Now, this is to ensure the safety of the workplace. We cannot resume to our workplaces and find that we are endangering ourselves or our colleagues, you know, to the exposure of COVID-19, which they will now take, you know, back home to their families. Maybe they have aged parents or grandparents, you know, who can, or people with comorbidities who can now be severely affected or may even die from the disease. So it is a positive policy decision. It is a positive strategy that is going to help, you know, to ensure that our workplaces are safe. Besides, we have to move from one point to another. It is not only the federal government. It is a chain of strategic decisions. You know, the federal government is doing this, but I'm aware that some states have already, about 3 states have already started doing that. And that will increase the number of people that are vaccinated in Nigeria. The private sector is also not left out. I'm sure that most of the, I'm aware that most of the multinational companies are also enforcing the vaccine mandate to keep their workplace safe. They tell all their workers that if you are not vaccinated, if you do not show evidence of vaccination, do not come close to the office, because you are constituting a risk. You are posing a risk, a health hazard to other people in your workplace.
Okay, now let's look at testing for COVID-19. This is perhaps the only way to authentically establish that a person has COVID-19. Has the country made improvements towards this direction?
Well, in terms of testing, COVID-19 testing are now available, widely available in the country. All the states have testing diagnostic centers, both in the public health facilities and also in private health facilities. However, it is still really disappointing that our numbers, the number of people who have been tested, is still abysmally low. You just mentioned the figure. We are not yet up to 2.5 million people who have been tested out of maybe about 200 million. And you now consider among this number, you have people who are repeat testers. If you travel, you are going to test at least twice, you know, when you come back. So it is like an average of 3 tests per travel. You do a test before you travel, and you probably do 2 tests when you arrive back. So if you back all that out, you realize that the actual number of people that have been tested is actually small. So people need to get out and know their status, particularly people who have symptoms. Our healthcare facilities need to intensify the screening. A lot of people are coming with the symptoms, but they are not tested. They're having fever, they're having cold, you know, they're having body weakness, some are having cough, you know, and yet they are not tested. We know that a majority of the patients, you know, these symptoms will just wane away. They will not lead to hospitalization, and therefore people will recover without even being tested and knowing that they have the disease. But they pose a risk of spreading that disease to other people and reaching the vulnerable ones who may.
Okay, let's talk about the cost of testing, which some might say is not quite affordable, especially for low-income earners. Are there any plans towards probably making it free?
Testing for COVID-19 is actually free for the general public in public health facilities. And the test is done for people who actually need the test. People who need the test are people who are sick, just like I mentioned, who come to the hospital with fever, cough, signs of flu, body weakness. These are people who should get this test free of charge. They don't need to pay. However, if you decide now you are not feeling sick, you just want to have a test, now you go to a private facility and you pay for that test because you want the test. It's not actually that you need the test. If you came into contact with someone who is positive, then you are a person of interest. So you need to have that test, and that test will be provided to you for free.
A few months ago, Nigeria placed travel restrictions on some countries. Are these restrictions still on?
We have removed the travel restriction on the 3 countries that remained on our restricted list. And this is because after review of the global risk and also reviewing the COVID-19 pandemic within these countries, we realized that the number of cases have continued to decline. Their test positivity rate was also declining. They have vaccinated a higher proportion of their population, and they are recording less hospitalization and less mortality. So we removed these countries from the red or the restricted list so that we can ease travel and businesses between Nigeria and these countries. Now, this does not mean that we have completely abolished the restricted list. We are still going to do a review in the next couple of weeks to determine the global risk of importation If there are new variants, we'll need to consider that and see the countries that will pose the greatest risk of importation of these cases to Nigeria, and we'll put them in the restricted list.
Okay, still on this issue, Nigeria had a fractured relationship with the United Arab Emirates. This was after the Middle East nation imposed a ban on transit flights from Nigeria as it battled a rise in COVID-19 cases. What is the relationship like now?
Well, so let me put it straightforward. Yes, we are in discussion, and really the relationship is not really fractured. So what happened is Nigeria suspended Emirates flights, from flying into Nigeria, and there were reasons for that. At that time, unilaterally, the airline decided to put additional test for Nigerians, which was a rapid test in conjunction with the other airlines. The other airlines quickly removed that rapid test, and they allowed the flights to continue. But UAE, or the Emirates airline, did not do that, and we went into kind of discussion and negotiation about how to overcome that event. They still insisted that they do not trust the testing from Nigeria. All other countries have accepted the test results that are going out of Nigeria. We have improved on our verification of these results to provide quality assurance. Nigeria is the only country that certifies its result. The government certifies the results before a traveler goes out. And yet the United Arab Emirates, do not seem to recognize that. They have come back to the discussion table now. We are discussing with them on a way to prove to them that the test from Nigeria is actually authentic. Right now, negotiations have reached advanced stage, and very soon we hope that we will be able to enjoy the flights back from Nigeria to the UAE.
Okay, one more question. We don't have much more time, but let me throw in this question. The World Trade Organization actually had intentions on supporting Nigeria produce its own vaccines. Is the country making any progress on this?
So production of vaccines is not something that you wake up and you do it overnight and you start producing. It requires a lot of intensive investment in terms of human capital, in terms of resources, the equipment, the technology, and also the time. Production of vaccines requires time. Even if we are going to get patent from existing companies, we have to reach an amiable agreement with these companies for them to come and start producing or finishing the product in Nigeria. So I can assure you, and I can assure Nigerians, that the government is fully interested in production of vaccines in the country. It makes economic sense. It is going to make it cheaper for us. It is going to help us to save our foreign exchange, and it will help provide jobs for Nigerians. So it is really something that we look forward to, and the government is seriously interested. And we're working not only with the WHO, but the private sector and all other academic society in Nigeria and many other stakeholders to ensure that we provide, a solid foundation to vaccine manufacturing for Nigeria.
Okay, just quickly tell Nigerians, just give them more advice on how to prevent COVID-19, how we can finally push it away.
Absolutely. So preventing COVID-19 for now, the most important and assured way of protecting yourself against the COVID-19 is to ensure that you get vaccinated. If you are vaccinated, even if you get infected, you are unlikely to be sick and you are likely to die from it. And the risk of transmission is even reduced if you are vaccinated. There's other ways to prevent yourself from having COVID-19 is to continue to wear your face mask, continue to abide by the regulations, avoid provide the social distancing, and also frequently wash your hands with sanitizers. But vaccination is the key. We need to not only get vaccinated, but urge everyone around us to also get vaccinated.
Thank you so much. There's so many things to talk about, but time is fast spent. So we must go. Many thanks to Dr. Mukhtar Mohammed, the Technical Head, Presidential Steering Committee on COVID-19. Thank you for coming on the program and updating Nigerians on matters arising from the COVID-19 pandemic. We do appreciate you.
It's my pleasure.
And to you, the viewer, thank you once again for staying with us. Don't forget, Nigeria Today is on weekdays at 7:30 in the evening. You can also watch the program on www.youtube.com/NTA News 24 Hub. Thank you for watching. I'm Lydia Odidiochi. Good evening.